Hello friends, today we are going to talk about a very interesting aspect of health, which is the religious fast during disease. Now, in case you have diabetes, any cardiovascular problems or any risk factors, it is important to think whether you can undertake a religious fast or not. But I would be dealing with one of the topics today, which is the Shravan fast, a very common Hindu fast. Usually this month falls between July and August in the Shravan period, and there are extensive fasts that are followed by the Hindu population. While some fast on 4 Mondays in the month, which is why it is called Shravan or Somvar, we also find that many people are doing this continuously through the year. Typically, people eat one meal during the day, and that will usually be the dinner. And the most of the day is then without any meal, and so there's only single meal a day. The foods that are usually avoided during Shravan fasting, as a general rule, it is most kind of the grains, which is like rice as well as the lentils, so cereals and pulses. Onion, garlic, radish are also avoided because they are considered tamasic by nature in Ayurveda. Even spices such as methi, turmeric, mustard seeds, red chilies are avoided, but they actually are good antioxidants. And non-vegetarian foods are also avoided, which is usually what we see in most of the religious fasts in India. Now, the foods that are allowed in the Shravan fast are usually fruits, certain vegetables which are part of the fasting diet, which tend to be more like arbi or lauki, potatoes or ratalu or suran, which usually are very high carbohydrate foods and very starchy foods. Also tapioca or sabudana, which is commonly eaten. There's rajgira, there is makhana. These two are otherwise healthy. Water chestnut or singara, the barnyard millet or the samo, these also may be eaten, which are considered reasonably healthy. The spices are usually avoided, but what is allowed is black pepper, green chili, coriander, ginger, clove, cardamom and cumin, that is jeera, which are usually healthy, and these should be included when the fasting diet is on. In this diet, there is a large amount of milk and dairy products like yogurt, paneer, etc., which is allowed, or homemade butter. But you'll find that this can be very high fatty foods, and hence we have to consider that. So considering the religious fast of Shravan, there are certain recommendations and suggestions I would like to give, which we must take into account, because if you are following this particular fast through the year or every Monday in once a week, it is important to note that this diet through the day is a very high starchy and high carbohydrate diet. So there have to be certain rules that need to be followed to stay in good health, or whether you have cardiovascular disease or diabetes or any blood pressure issues. So the first rule of fasting is that you must stay hydrated. You must incorporate in the diet on a Shravan day is that there's buttermilk, there's unsweetened lemon water if you have any diabetes, and all these have to go with your meal so that you stay well hydrated and you also get some protein through the buttermilk and milk products. You can incorporate the dairy products like curd, yogurt, buttermilk, etc. as lassi, as chash. What you need to remember is that it should be from a low-fat milk version. Otherwise, you're taking in a lot of high amount of saturated fat also. One should include the nuts such as almonds, walnuts, which are healthy fats for the heart, so it's a bonus. Then rajgira, as you have, a singara, some of these which can be used as flour to make parathas or rotis is quite healthy. But what can be done is that you need to avoid the sweet potato, the yam or any kind of other potato version, because it is extremely starchy. So instead of consuming rice on the day of a Shravan fast, you can opt for millets. A variety of millets can be used, and that can be used to make khichdi or to make a chapati, which is a far healthier version, and it keeps the starchy foods out. Thank you for listening in, everybody. It is important to consult your doctor before you undertake a religious fast, especially in any medical condition. So kindly do so, and please take into account the nutritional ideas so you have a far healthier fasting day. Thank you. Take care.